Hiya, my name's Laura and today I'm going to be your student practitioner. Today I'm just going to ask you a few questions about your present condition to understand more about your injury. So I'll be asking you about your symptoms, the mechanism of your injury, how the pain's feeling. I'll also be asking about your past medical history and more about your social activity. And after I've done this, I will also collect an objective assessment from you. So I'll just ask you to perform some active range of movements. But I'd just like to let you know before we get started that all of the information shared today is confidential and you can stop the assessment at any time if you feel uncomfortable. And if there's any discomfort, please let me know immediately. Are you happy with all that information and okay to continue?
Yes.
Can I please just confirm your full name and date of birth?
Yeah, it's Josh Smith, 31st of the 3rd, 2001.
Perfect. So with your present condition, can you tell me the mechanism of your injury, so how it occurred?
It happened during a rugby match when I got tackled.
And were you wearing rugby trainers?
Yeah.
And would you say this was near your MCL area then?
Yeah.
Okay, so would you say when it occurred, it was a deep feeling or over a large area?
It was quite deep.
Okay, and would you say it was a sudden pain or did this pain come on gradually after the injury?
It was a sudden sharp pain.
Okay, so the characteristic was quite sharp then?
Yeah.
Perfect. And would you say this pain is quite severe? Like there's a pattern to it, there's a timing difference, the distribution changes?
At the time it was quite a lot of pain. It was an 8 out of 10 at the time.
Okay. And would you say there's any other symptoms that you think are associated with this injury? Like have you been feeling weak anywhere else?
I wouldn't say so, no. It's just I've been having quite a lot of swelling since the injury.
Okay. And would you say it's any better in the AM or PM?
After I'm in a static position for a long period of time, it gets worse, so I would say it's worse when I'm waking up.
Okay. And is there anything that helps, like hot or cold compresses, certain stretching, rest, any drugs that help with the pain?
I've just been finding that resting and wearing the brace has made it a bit better.
Okay, perfect. And what would you rate the pain at the moment out of 10?
I would say between a 2 and a 5 out of 10.
Okay, and it was higher when it originally occurred?
Yeah, 8 out of 10 at the time.
Okay, so I'm just going to ask you some questions about your past medical history. So could you tell me if you've had any previous injuries, issues with your thyroid function, heart, anything like diabetes, asthma?
I was diagnosed with asthma and I'm using a preventative inhaler for that. I also had a right gastrocnemius strain and a hamstring strain.
Okay, and what's your drug history with all of that? Obviously you've got the preventative inhaler, but are you taking any prescribed drugs at the moment or any recreational?
Yeah, so since my injury I've been prescribed ibuprofen.
Okay, and can I ask a little bit about your social history? So what's your training like every week?
I train 4 to 5 times a week and do a match every week, which is quite high intensity, along with strength and conditioning training.
Okay, perfect. And can I confirm that you play flanker in rugby?
Yeah.
Perfect. And so now we're just going to move on to the objective assessment where I'm going to talk you through some active range of motion. And I just want you to just go to where you can. Let me know if there's any pain. Don't push any further than you're not willing to. And yeah, let me know if there's any issues and we can stop immediately. Are you okay to carry on to that?
Yeah.
So now we're just going to move on to the objective assessment. So what I'm going to do is give you some verbal instructions so that we can measure your range of movement as well as your quality of range of movement. And please let me know whilst we're doing these if you experience any pain at all. So starting with extension, I'd like you to imagine that you've got an egg underneath your knee and I just want you to push down as if you're trying to break that egg. So can you do that on your left leg, please? Perfect, so that moves it into slightly hyperextension, and again on your right. Perfect, and was there any pain during those movements?
No.
So now I'm going to check your knee flexion. So if you could bend your knee up towards you and slide your heel as close to your bum as possible, keeping your foot flat on the bed for me. Perfect, all the way. And then back down. And then same on the other side, please. And back down again. Was there any pain in those movements?
No.
So now we're going to check your medial and lateral rotation. So I'm going to assist you on the movement first, and I'm going to ask you to then replicate it. So are you okay for me to palpate around your knee? So I'm just going to put my hand here, and then just move you medially and laterally. Now I'm going to keep my hand here. Can you replicate that movement for me? Perfect. And then can we do the same on the other knee? Perfect. Now, was there any pain in those movements?
No.